Your labs are normal. So why do you feel terrible? These are four words that have probably confused more women than almost anything else in modern medicine. Your labs are normal. Think about that for a second. Those words are supposed to make you feel relieved. Instead, for millions of women, they become the beginning of an entirely different frustration. Because maybe you've heard them too. After months of waking up exhausted, after watching your hair thin, after wondering why your body suddenly feels 20 years older than it did just a few years ago, after trying another diet, another workout, another supplement, another cup of coffee, you finally decide maybe I should get checked. So your doctor orders blood work. A few weeks later, the phone rings. Good news. Everything looks normal. You hang up, you look at the reflection and quietly ask yourself, and why do I feel terrible? Can I tell you something that changed the way I practice medicine? The question may actually be wrong question because your blood work was never designed to tell you whether you feel incredible. It was designed to answer something else. And once you understand that difference, you'll never look at your lab results the same way again. Imagine walking into an airport. You pass through security, no alarms, no problems, you're cleared to board. Does that automatically mean you're ready to run a marathon? No, of course not. Airport security has one job: find dangerous threats. That's it. Medicine works much the same way. Most routine blood work is incredibly good at asking questions like: do you have severe anemia? Is your thyroid failing? Are your kidneys working? Is your liver functioning? Do you have diabetes? Those questions save lives, and I'm incredibly grateful they do. But notice something: those aren't the questions most women are asking. Women come into my office asking, why do I wake up exhausted? Why can't I recover after a workout anymore? Why am I losing muscle? Why is my hair falling out? Why do I feel older than I actually am? Those are not the disease questions. They're function questions. And there's an enormous difference. Here's a sentence I wish every patient understood: the absence of disease is not always the presence of optimal health. That's not somatics. It's one of the biggest blind spots in modern medicine. When I was younger in medicine, I believed what most of us are taught: normal labs, normal patient, simple. Then I started seeing something I couldn't ignore: women whose lab work looked reassuring, but whose lives clearly weren't. They weren't imagining their fatigue, they weren't inventing brain fog, they weren't suddenly becoming lazy. Something real was happening. The lab work wasn't telling the entire story. That realization changed how I looked at medicine forever. Not because lab work isn't valuable, it absolutely is, but because I realized numbers never tell the whole story. People do. And that's when I started asking a different question. Not what's abnormal, but what could be missing. Think of your body like a company. Every single day, it's making thousands of decisions. Where should energy go? What gets repaired first? What can wait until tomorrow? Because here's something most people don't realize: your body is constantly triaging, just like an emergency room. If two patients arrive at the same time, one with a paper cut and the other one having a heart attack, you already know who gets treated first. Your body works exactly the same way. If resources become limited, it protects what keeps you alive: heart, brain, kidneys, lungs. Everything else has to wait its turn. And that's why one of the very first places women often notice something changing isn't their heart, it isn't their liver, not their kidneys, hair. Hair is incredibly expensive tissue. Your body doesn't need beautiful hair to survive. It needs oxygen, it needs a heartbeat, it needs a functioning brain. So when nutrients becomes limited, or hormones begin changing, or significant stress occurs, here is often the first places your body starts conserving resources. Which brings me to one of my favorite laboratory tests: ferritin. Not iron, ferritin. Most people have never heard of that word, but I look at it all the time because ferritin isn't simply how much iron you have today, it's how much iron you've saved for tomorrow. Think of it like this: your checking account pays today's bills, your savings account protects your future. Ferritin is much closer to your savings account. You can have enough circulating iron to keep today's lights on while your reserves are quietly disappearing. Now, does every woman with hair loss have low ferritin? Absolutely not. Hair loss has dozens of possible causes: genetics, hormones, autoimmune, thyroid disease, medication, stress, nutritional deficiencies, and even more, right? But ferritin is one clue that is frequently overlooked, not because it's magic, because biology is rarely explained. Then there's another lab that fascinates me, insulin. Almost everybody knows glucose, but very few people understand insulin. Here's why that's important. Imagine two women sitting next to each other, same age, same weight, same fasting glucose, both perfectly normal. If you stop there, you'd assume their metabolism looks identical. But then you measure insulin. One woman's pancreas produces a small amount, the other produces 4 times as much, just to keep her glucose normal. Suddenly, those two women aren't metabolically identical anymore. One woman's body is whispering, I'm working a lot harder than it looks. The other, that's one reason glucose can remain normal for years, while insulin resistant quietly develops behind the surface. Your body compensates until one day it can't anymore. And that's true for metabolism. It's true for hormones. It's true for chronic diseases. The body whispers long before it screams. Then there's vitamin D. Can I tell you something that surprised me early in my career? Vitamin D is not just a real vitamin. It behaves much more like a hormone. Its receptors are found throughout the body: muscle, bone, immune cells, brain, skin. Now, low vitamin D doesn't explain every symptom. In fact, many people with low vitamin D feel perfectly fine, and many people with fatigue have normal vitamin D. That's important because medicine isn't about blaming one lab. It's about building a complete picture. Every piece of information adds context, not certainty. And that's one of the biggest mistakes social media makes. It promises certainty. Medicine rarely does. Medicine works in probabilities, patterns, context. And that's exactly why one lab value should almost never be interpreted by itself. So, if there's one thing I hope you remember after watching this, it's not a laboratory test, it's this. Your lab results are not a report card. It's not your identity. They are not the final word on your health. They're pieces of evidence, pieces of a much larger story. And like every good detective knows, one clue is never enough to solve the case. Your symptoms matter. Your history matters. Your age matters. Your sleep matters. Your nutrition matters. Hormones matter. Your goals matter. And yes, your lab work matters too. But none of them should never be interpreted in isolation because medicine isn't about treating numbers, it's about understanding people. I think that's where we've gone wrong. We've become incredibly good at measuring the body and sometimes forgotten how to listen to the person living inside of it. So the next time someone tells you your labs are normal, don't let that be the end of the conversation. Let it be the beginning of a better one that asks, what story is my body trying to tell me? Because biology always leaves clues. Our job is to learn how to read them. I'm Dr. Rizwana Zaidi. Every week on this channel, we'll uncover science behind the symptoms so you can understand your body instead of fearing it. Because the better you understand your biology, the better decisions you'll make for every decade that